So the next Ask ID is I have developed white patches of skin around my eyes, around my mouth and on my hands. Do you have any idea what this is and how it might be treated? So obviously without seeing someone you can't tell for sure, but this sounds like vitiligo, which is essentially a chronic pigmentary disorder whereby progressively somebody will notice that their skin is becoming paler. So these kind of milky white patches called leukoderma, where essentially the melanocytes, which are the pigment producing cells of the skin and the hair, are being lost and the skin is looking paler. So you may not notice it as much in a very, very fair skinned typical Irish patient who has type 1 or type 2 skin, particularly in the winter when they might not have any tan, but certainly people start to notice it if they try and tan other parts of the skin and this doesn't tan equally, or in individuals who have darker skin types, they will notice a lot more, and it's cosmetically very debilitating in much darker skinned individuals. It tends to often be symmetrical and occur around sites of repetitive trauma, so usually around orifices such as the mouth, the eyes, and then commonly seen under the arms and the groin area, and again the hands and the feet. For treatment, the face and the trunk tend to respond better, and the feet and the hands actually can be a little bit more difficult to treat. But obviously the sooner somebody recognises that they have an issue with potential vitiligo, the better it is, because the earlier they start treatment, we have a higher probability of improving the situation versus someone who's had it for 10 or 20 years. So we would often start off with trying to stabilize the vitiligo to prevent further patches from occurring, often using topical steroids or even a short course of oral steroids if it's rapidly progressive. We can use other topical agents which are steroid free called calcineurin inhibitors, and some patients will respond well to UVB phototherapy, sometimes combined with the calcineurin inhibitors. We also have systemic agents, and there are some newer creams on the market, such as ruxolitinib, which is a JAK inhibitor, and some of the other JAK inhibitor therapies have also been shown to improve vitiligo. But of course it all depends on the patient's severity of their condition and how much it actually bothers them. The thing about vitiligo is it's not dangerous, it's just cosmetically very annoying for people. But the most important thing is in that the area that you have no pigmentation means that you've absolutely no protection from the sun. So the most important and baseline daily treatment that someone suffering with vitiligo has to use is sunscreen and a style of clothing to protect the skin. So for example, for the face, you can either choose a clear version or a tinted version if you want the skin to have a light glow. And then obviously for the body, you want a bigger bottle of cream. So something like the UV Sport, especially for people who are outdoorsy. Don't forget that our hands and our face are exposed all of the time, regardless of how good the weather looks. So all year round, driving the car, your hands are like this. If you're on a bike, your hands are like this, pushing a buggy, for example. So the hands really do get an awful lot of exposure. So it's really important that anyone struggling with vitiligo would use regular sunscreen and a style of clothing to protect their skin.